Hello and welcome to another edition of the NeuroOp Guru. I'm here with my good friend Drew Carey. Hi, Dr. Carey.
Hey, Andy.
And today we're going to be talking about recurrent papilledema after stopping GLP-1 receptor agonists. So, Drew, why would people have to worry about papilledema to begin with in GLP-1?
Well, we are finding from a number of studies that GLP-1s may help to treat elevated intracranial pressure from IIH or idiopathic intracranial hypertension for a number of reasons. One, that we know they work great for weight loss, and weight is a major risk factor for IIH and weight and vision loss and papilledema. We know that rebound and weight gain is a major risk factor for vision loss and recurrence of symptoms. And we know that a lot of our patients taking GLP-1 receptor agonists are discontinuing them either because of side effects or cost. And if we're lucky, we might have some generics, so maybe cost is going to come down. And some studies out of the UK have actually shown that with at least one of the GLP-1 receptor agonists, within 24, 48 hours of starting it, they are actually seeing weight independent lowering of ICP in patients that they have shunt and have put an ICP center in as part of that. So it may be that we can use these medications for treatment, irregardless of weight loss in these patients. That being said, anytime we stop a medication that's working, we have to worry about what's happening to our patients. Are they going to get worse?
And do you think it's gonna like a rebound effect, or it would have happened if you had just said recurrent papilledema after stopping Diamox? It would just be the same thing.
We don't know the answer to that one because these are newer medications, and a lot of our patients, we don't have strict protocols in place for monitoring them after they start the medication or stop the medication. This is a newly recognized phenomenon. We don't know what percentage of our patients this is impacting. I've had patients who were on GLP-1s and they lost a lot of weight and they stopped them for whatever reason and they didn't have any worsening of their papilledema. But in patients with advanced vision loss, pre-existing optic disc pallor, like in this patient, we worry about them certainly getting worse because and they're certainly, if you have vision loss, you're at high risk for further vision loss, right? We know our patients good vision have good outcomes. Our patients presenting with poor vision have poor outcomes.
So maybe you could just walk us through the case report and then give us the take-home message.
Absolutely. So this was a 31-year-old female, as we see with most of our patients with IIH, who has a long history of at least 7 years with pretty severe papilledema. They underwent optic nerve sheath fenestration 4 years ago and last seen 1 year ago. And at that visit, no papilledema, advanced vision loss in the left eye, just a little tiny central island of vision, and the right eye had this probably germ or central scotoma that was seen. And they were on GLP-1 medication. And after stopping it, the semaglutide, they had recurrence of their headaches and pulsatile tinnitus that started about 1 month after stopping medication. We know those are our most common symptoms for IIH, and certainly the pulsatile tinnitus is probably one of our most specific symptoms for papilledema. And were seen and had worsening of their papilledema recurrence. And the visual field on the left was not worse, but the visual field on the right did show worsening of that nasal scotoma and central scotoma, concerning for progression of vision loss from their papilledema.
So what should be the take-home message for our audience today?
I think the take-home message, number one, this definitely adds to the evidence that these medications work when they're taking them. But I think we need to tell our patients, hey, if you have to stop it for any reason, please watch out for your symptoms. And as always, if your symptoms are worse, let us know. But maybe we should have some type of monitoring protocol in place for these patients when they stop the medications, see them within a month or two just to make sure they're not having recurrence of papilledema. And if they have advanced vision loss to begin with, maybe we need to check them sooner after stopping medications.
Good advice, Dr. Carey. This concludes yet another edition of the NeuroOp Guru.